Welcome back to the Pulse. My name is Samuel Kojo Brace. Now let's talk about something very disturbing because it's something that affects all of us. Now in the second part of the Joy News feature on the National Health Insurance Scheme's dire challenges, we delve into the heart of the matter at Afenyo-Markin Teaching Hospital, where the underfunded scheme has left countless patients stranded at the hospital premises. Despite being a beacon of hope for many, the NHIS has faltered, forcing subscribers to pay for medicines that should have been covered by the scheme. My colleague Clinton Yeboah uncovers the painful truth in today's feature.
We have also extended NHIS coverage.
This is the Vice President, Dr. Muhammadu Bawumia, confirming over 61% increase in NHIS registration numbers since 2017. But do these numbers mean anything at all, especially with the level of quality of services being provided in various hospitals across the country? Outside of the imposing gates of the Accident and Emergency Unit of the Afenyo-Markin Teaching Hospital and the waiting room of the KNUST Hospital, a restless crowd gather with their faces imprinted with worry and desperation. These are not just visitors earnestly waiting for good news concerning their sick relatives, but patients and family members perturbed with medical bills they cannot foot. Gifty Boache almost shed a tear talking about her sick mother. She has spent days at the hospital, banking hopes on the National Health Insurance Scheme, which she describes as stale.
Insurance and say we scapa now bibi yale and now bibi wa and one so da ho wo me ba ha pa na mbe hu se enye tim sa Ghana ayedin wonni bi pa wonni se wonni bi a obibi wa no so wo.
The scheme has become stale. Now, if you do not have money, you won't receive quality health care. Why? We have to pay for almost all the services received.
There have been several complaints about the quality of NHIS service provided by some health facilities across the Ashanti region. Some individuals are reporting long delays in receiving treatment due to not having a health insurance card. They disclose instances of lack of essential medication due to inadequate coverage of expenses. These required subscribers to purchase medicines that they expected should be covered under the scheme.
Look at
the number of drugs they have prescribed for me. Why would we be buying all sorts of drugs if it's working?
Oh yeah, Juma. I do you free now. Last we register there. Oh yeah, more yemo. Last no best animal now. Oh yeah, more. Kato dru.
They took 20 cedis before giving me a bed in the ward here in Kumasi South Hospital.
Bed no 20 Ghana cedis. Without receipt. To me, when they cover me, when I be the Bahasi, much as beautiful Dunquao, and a Bahasi, a Baya, almost a paniho, and pass short. Massa making it's not, and a Bahaman number 6 o'clock. A Bonaju, 1 o'clock, and Pama, Mimami, Albadaso, a Lucrampuno, the Tiesca.
I brought my mother, but we had to pay a bribe of 100 Ghana cedis before getting a bed. I have bought all sorts of drugs for 2,000 Ghana cedis.
Health insurance, and yes, I said, and no, which your man in the Gisecoto. And yet more Hassi. Health insurance, necessary yet more Hassi, because no Tony and Matudo almost 50 Monday in payment, but to do a couple of 2,000.
For these aggrieved individuals, the struggling National Health Insurance Scheme is not just a health administrative obstacle, but a point of evidence of poor health systems and the inflicting reality of the poor. This is Samuel Tay Wayu.
A draw, Nibo, and Yedden, and a health insurance cover. and a be a card. I say, draw any boy, didn't say beer over
The ones that are given free are not expensive, but the expensive ones I have to buy. This is my card, and I don't see any need.
You see, I'm about near cover crown, so movie anyway, or much or trade drama may be 7 cotton. I ain't over 33,000. Health insurance to be uncovered.
According to the 2023 medicine list of the National Health Insurance, appraised by a specialist group, the currently reviewed medicines list contains a total of 548 formulations. Childhood immunizations, tuberculosis, HIV/AIDS, and mental health care are exempted from the scheme. The document disclosed that executive management of the NHIA has directed and approved a 20% increase in the prices of medicines as a stopgap measure to mitigate the recent increases in prices of medicines on the open market. A health official who pleaded anonymity explains the hospitals are compelled to top up prices of drugs and medical consumables due to price disparities in the open market price and the bench price covered by the NHIS. The situation seemingly grants profit-seeking hospitals a chance to charge patients more than required as top-ups.
Insurance has its own pricing for each drug. If that is not the price that the hospital gets on the market, that means the patient has to pay for the extra amount. Because insurance price is usually so low that you go to the market for the equipment that you need for the procedure, and it will be way above the price the insurance is going to pay. So you have to add the difference for the patient to pay. And some hospitals actually add extra for profits.
He further disclosed underfunding of several hospitals and bureaucratic hurdles of NHIS medicine administering guidelines are engulfing several facilities.
You when they list the drugs, it means you have to stick to what they've said. Insurance sometimes they will reject it entirely and flag it as wrong, so they won't pay because they have specific treatment guides that you have to follow. If you go out of that, they have so many rules, so the hospitals would have to find ways and means to make up for all of that. Insurance is a stickler for rules.
Efforts to reach the Ashanti Regional Health Insurance Office have proven unsuccessful, but health officials are proposing an increase in premium drugs covered by the NHIS.
I believe funds to facilities should be released on time for them to be able to get the needed consumables for work. I also think that premium should be increased for especially those who can afford, those in the formal sector whose deductions are made straight from their SNP contributions.
Universal health coverage in Ghana says that all persons should and must receive timely access to health care. It is then apparent that a national entity such as the National Health Insurance accrues some attention to the struggling portions in order to improve service and ensure that we achieve the universal health coverage targets. Reporting for Joy News, my name is Clinton Yeboah.
Well, the current CEO of the NHIS has been appointed as the Minister of Health. Let's see how he can use his experience to turn around the fortunes of that scheme. But still staying in the health sector, the Afenyo-Markin Teaching Hospital is turning some patients in need of dialysis treatment to private facilities due to insufficient equipment for the procedure. Presently, only one dialysis machine is fully functional, supporting another partially working. Chief Executive Officer, Professor Dr. Ochre Adai-Mensah, says the decision to limit dialysis to patients of the hospital is the hardest taking under his tenure. He spoke at a meeting with the finance minister who toured the mother and baby unit being constructed at the hospital. Nanaya Ojima has more in the following report.
Dialysis is a procedure to remove waste products and excess fluid from the blood when the kidney stops working properly. The failure of kidney patients to get the service when necessary may lead to death. The Afenyo-Markin Teaching Hospital is a referral hospital for 12 of the 16 regions in the country. Its nephrology unit is challenged with the necessary tools for the procedure despite the relevance. Professor Ochre Adai-Mensah explains some critical decisions the hospital has taken.
The truth is that we at Afenyo-Markin presently have, I usually say, 1.5 dialysis machines. And it's because one is working at full capacity, the other is working at fault. And so what it means is that we are no longer able to receive patients from outside for dialysis. So the dialysis in this hospital is restricted to 2 patients who are within the hospital. One of the most difficult calls I have had to make as a chief executive was when I was approached by my medical director, and who posed a question as to whether or not he was okay to send patients who needed dialysis to private facilities for dialysis. As difficult as our call was, it had to be made because we do not have sufficient dialysis machines. And Mr. Minister, the truth is that for each dialysis session, it takes 4 hours. And so what it means is that if you have 2 dialysis machines in-house and you have, say, 5 patients who need dialysis, what it means is that if God does not intervene, then by the time he gets to the 10th or the 5th person, he probably would have popped off.
The tooling challenge of the hospital is not limited to dialysis machines. For over 18 years, the hospital has been without mammography machines.
One key example is a mammography machine, which for the past about 18 years we haven't had one. And so we are picking up breast cancer cases in stages 3 and stage 4. Apparently about 70% of the cases of breast cancer are diagnosed in stage 3 and stage 4, basically because the effective screening that ought to be done with the help of a mammogram machine not being done.
Meanwhile, the challenge with spacing continues to affect the hospital's operations. Professor Dr. Adem explained though the hospital is constrained, they are forced to congest their facilities.
Indeed, if Komfanochi decides to close off the emergency center for 24 hours because it is full, and as we speak, the place is meant, orange ward is meant for 12, we presently have about 42 patients. Yellow is meant for 18, we have about 27 patients. Red is meant for 7, we have about 10 patients there as we speak now. And so if we decided that we're no longer receiving emergencies, obviously because the place is full, what it means is that we are practically asking patients who come in who are turned away to go and die.
The release of funds for works on the mother and baby unit comes as a relief for many in the Ashanti region. Finance Minister Dr. Mohamed Amin Adams reveals 14 million euros have been released for the purpose.
Can I show you, because of the concern by our president, the directive for us to find money and address these outstanding infrastructure issues. You have seen us moving very quickly, and this visit by me demonstrates that commitment to addressing these challenges so we can bring relief to the people of Kumasi, Ashanti region. And I know that a lot of cases are referred to Komfanochi from other regions of the country.
For Joy News, Nana Ojima, Kumasi.